And we are back once again at Island Foot and Ankle Surgery with Dr. Ben Overley. And we've talked previously about sports injury and trauma. And so obviously they all kind of go together, but we're just going to do one big umbrella about injuries, and you're going to kind of tie everything up for us.
Yes. I think that would be great for your viewing audience. Is if you understand a couple different things, I'm going to dispel some myths and rumors for you. So when we were talking, I've talked earlier about sprains and strains and fractures. Number one, a break is a fracture. Somewhere along the line, someone thought that a break is different than a fracture. It's the same thing. What they're thinking of is an open fracture where the broken bone actually comes through the skin versus a closed fracture where the skin envelope stays intact. That's really the differentiation. Okay. And it used to be referred to as a compound fracture. Okay. So when we look at the foot and ankle, when I think about most common injuries, ankle sprain is going to be probably your biggest one. And almost everybody's had a sprain in their life if they're in their late 30s, 40s, 20s even, and they've participated in any kind of sports or sporting activities. Ankle sprains are very common. But there's all different types of sprains, and they shouldn't be underestimated or blown off. You should seek treatment or care for these, because if you don't, then what eventually will happen is you will develop arthritis in the ankle, and then you'll require a more definitive procedure rather than just having something simple such as, which I do all the time, is to scope the ankle and to clean out any cartilage tears, strengthen any ligaments internally through the arthroscope. So doing all of that is fantastic, and I can assure you would rather have those procedures done rather than an ankle replacement or an ankle fusion. So
I'm going to believe you on that one.
Okay. So the most common ones that we see are really ankle sprains. Second is probably Achilles injuries. And if you think about an Achilles injury, this is typically your weekend warrior. This is your guy that played high school football and he's had a few beers over the years, and he decides he's going to go out and play a sport when he hasn't done anything except for work a remote control for the last 10 years. And he decides this would be a good time to play flag football on the beach with a bunch of 16-year-olds. So this is typically characterized by, again, the weekend warrior individual, and rupturing the Achilles does not always have to be complete. It typically happens 4 to 6 centimeters above where it inserts, which you can see sort of the dent and crevice on the back. That's where your Achilles attaches. The Achilles itself is a very short tendon. The entire structure is long, but the tendon itself is very short. So you can get chronic tendonitis from that. You can have difficulty walking from that. This can also be microtrauma from distance running. Perhaps you are a trail runner and you're running uphill a lot. That can happen that way. And then there's also something too, if you've been on certain medications, can actually induce Achilles ruptures. And the most common one are the fluoroquinolone antibiotic family, which is ciprofloxacin, norfloxacin, and levofloxacin or Levaquin, which a lot of people take. So it is very important that if you are on these medications, you should cease and desist any kind of forceful movement training, such as weightlifting. This is not the time to be, you can rupture your biceps, your triceps tendon. And the Achilles, being the strongest tendon in the body, is most susceptible to it. So, and it also weakens the ligaments and everything else. It's a byproduct of the drug, but if you need the drug, keep that in mind. Walking is fine, of course. Biking, swimming is great, but really try and resist from doing the really heavy impact with forced eccentric load exercising, such as weightlifting and things like that.
Interesting.
Yes. So, and these are really the most common things. Now, there's, of course, a myriad of different trauma things that can happen to the foot and ankle, but we really sort of separate those into, is it soft tissue, is it bone, or is it both? Typically, if it's bone, there is some soft tissue involvement. We fix that at the same time as we repair the bones. And typically, if they are done and they are put back in place and the individual is healthy, they will have a full recovery and return to sports or their activity in no time.
Well, Well, as always, I learn a lot from you, and I know there's so much more that we could talk about. So we'll be back again soon to do
Okay.
just that. Thanks so
Thank you.
much.